Hello and welcome to the Auditing Antics podcast. So we're back today for our last episode of 2025. We had last week off. We both had some good family time, some downtime, just in different places. Some
Yep.
of my family was down there with Michelle and our parents, and you got to have fun again at Disney with my grandson, my
Yes.
youngest
Yes.
daughter.
Sometime you're gonna have to come experience Disney with him because for such a little
Yeah.
guy, he really just takes it all in, and I absolutely love how nosy he is.
Mhm.
He's a little people watcher, and it was absolutely hysterical, but he loves Disney. I I think he does great, and he seems to really take it all in.
Yeah. And you all got to experience the craziness and his energy level that is draining all of us.
Yes, that poor mom and dad, they stayed at mom and dad's house, and, I think mom was ready for a vacation
Yeah, yeah,
after. But it's so fun, that's how he's supposed to be. That's how
yeah,
you want them to be at that age, to be busy and getting into everything, so it was a lot of fun. And
yeah,
of course, Kylie too. It was a lot of fun
yes.
having Kylie there.
Yeah, I got to go to Delaware, so our cousin is in Delaware. I got to spend time with her and her kids, and then Saturday, her and I traveled over the border into Pennsylvania. Our aunt and cousin lives in Lancaster, and that was a lot of fun because I was trying to remember the last time I'd been there. It's been forever, but
Oh, I know.
for anyone who's been to Lancaster, you know exactly what I'm talking about here, but there's nothing like it when you're in there in the Amish country, and the food is amazing, and of course all the baked goods and the candy and all of that. There's just
Yes.
nothing like it when you get
No.
to experience that.
The good old Shoddy McCall.
Yes, the shady people.
Well, Dad put it in the GPS with a Q instead of a P, so it was the Shoddy McCall.
Yes, but it was a lot of fun.
Uh,
So now, for today's episode, we're going to be reflecting some on, what we are noticing as standouts from 2025 and then what we should really be looking for in 2026. And I feel like more and more with what I've been working on, just because, with my clients and the type of work I do, I have a lot of variety there. But, there's definitely some things that have stood out in 2025. And before we went live, we were talking some about the fact that, a lot of the audits that we've been working on this year have involved a lot of situations where the organizations have had active coders
mhm,
involved, but we're still seeing a lot of disconnects. And it was kind of eye opening, just wondering, trying to get in the mindset of that organization. How
mhm,
are you training your staff? How are you supporting your staff? Sometimes people are doing a lot on that front end and training, but then they're never following up, and you
mhm.
get caught up in the busyness of,
Yeah.
the revenue cycle. And, it really is something that has stood out to both of us in relation to the fact that these things are still happening when the organization is investing in coding professionals.
Mhm. Yeah, and something that, along the same lines that I've noticed that can be just as alarming is who they have doing the training. And sometimes the conversations we're having with the people who are in charge of training the coders, it's like no wonder there's a problem, or we go and we find out that there isn't any type of ongoing training
Mhm.
that's done. So that I think is a real issue if you're with an organization that doesn't take the training of your coder and auditing staff and making sure everybody is on the same page. Because in all honesty, I worked in a facility where the coding and auditing teams of people didn't even work together, and
Yeah.
we only heard from them when they did some kind of review, and they were like, why is this wrong? And it's
Mhm.
like, what do you mean? We should be knowing what your audit plan is. We should be able to have these discussions and work together. It's not really intended to be two separate parts of your organization. Like, they should be working together and kind of synonymous and know what the other is doing.
Yeah, and I want to take a step back here and point out, we're not attempting to be overly negative in this
No.
episode towards coders. I mean, obviously
Mm-mm.
this is the industry we work in. We
Yes.
started out as coders, moved into auditing, but it's one of those things where we've got to break this apart and, like you said, look at each piece of that puzzle, but we've got to understand, okay, what part am I playing in this? Am I working in an organization that expects me to be a yes man no matter what's going on, or a yes woman? If that's happening, we've talked about this before. It's time to question what it is that you're doing in an
Mhm.
entity like that. But, overall, it's really frustrating when we know that this is a great industry. A
Mhm.
lot of people work really hard to get into the positions they're in. And sometimes you have people who are willing to learn whatever they need to learn. They're
Mhm.
doing everything that's expected of them. But then at the administrative level, maybe they don't want to argue with a physician or some of the
Yes.
practitioners. Or maybe they are an organization where there's ownership by physicians and you have a board that you have to answer to. And all of these different levels start to add into people's opinions and
Yes.
getting away from the truth and following more the feeling and all of those types of things. And I have to say it's been frustrating to still see that this is happening in 2025, but to see it in a way where it seems to be done so blindly, meaning that it's just the everyday thing that's done. Get through your volume, leave for the
Mhm.
day, move forward to the next. Not giving
Absolutely.
much thought to that.
Yes, and it really is, it's not a failure on the coder's side. That's not what we mean at all. It's the resources, it's a failure in the resources that are being put into them. I know in my very first coding role, it was extremely difficult to get any type of additional education. In fact, I moved into a role where I became the additional education. Um, you
Yeah.
that's how it had to be handled, and um, there was a real lack of ongoing communication and understanding, and even the changes, we were often told it's up to you to keep up with the changes. Well, when do you expect me to keep up with these changes, because you also expect me to get through this volume of coding as well? So it kind of can be this double-edged sword.
Hmm.
So it's one of those things that, you may, as a coder, have to start looking at resources on your own and know that it really stinks that, your company isn't putting that effort into your continuing education, but there are so many resources out there that can be utilized
And I
to
think,
increase that education on your own, if that's a position you're in. And I would encourage you that if you're doing that, do that with what's next in mind, what's next for you in
mhm.
mind, not just benefiting the people who aren't putting anything into you. How are you going to take that and benefit yourself?
Yeah, and I think this is a lesson too for those in leadership because things do get crazy.
Mhm.
There's a lot of goals that you may have for the department that you're in, or if you're leading a department, and we all know that's going to dismantle over the year. There's different things and different input from other people that are going to take priority, whether you want it to or not, and it
Mhm.
can fall apart. But, it's one of those things where I know when I, for example, started to get in a position of leading more and supervising and things like that, I had to train myself in leadership to not just answer a question because I knew the answer and it was the easy thing to do. And, really encourage people to come to you with the solution and talk through how they got to what they think the solution is and then go from there.
Mhm.
And, if you're in a situation where you're leading departments or things like that currently, think about in 2026 moving forward with giving your team some tools as far as what they can personally do, not meaning, giving them coding software and things like
Mhm.
that. Have you walked through the CMS website with your team? Does your team know that there are CMS contractors, what that website looks like, what
Mhm.
all of those resources are on your Max website, which are huge? Those types of things are what is going to put this in play, where no, it's not the leadership's responsibility to do this for the team, but in some way they've got to be taught, because
Yeah.
I know I've worked with people for years and would be questioned at some points, and they say, well, I have this question, and I'd ask them, well, who's your Mac? Who's your contractor? They don't even know that that's a thing, or how to go on to CMS
Mhm.
websites or things like that. So it's a
Yeah.
really good place to start for yourself if you're a coder and feeling unsure, or if you're leading your team and you don't even know what type of background or education's really been invested into them in the past. That's a good starting point.
Mhm. I would also recommend going back to the basics with your team. How many errors do we find in our audits that could very easily be corrected if the coders were going back to the basics? So, having some exercises where you're encouraging review of things like ICD 10 guidelines, encouraging review of CPT guidelines. Like we've always said, look around what's going on around the code and all of those things. So, even going back to the basics, whether you have a newer team of coders that are just getting started out in the industry, or if you have a seasoned team of coders. I think that sometimes we fall in the trap of getting comfortable. I know that that has happened to me where I have gotten comfortable with a certain item or auditing a certain service. And then it's like, I go back and I read and I'm like, oh, well, that's something new. That would have been, you know, that would
Good
have
to
been
know.
good to know, or think about. And, so even those of us who have been in the industry, go back to the basics and encourage your team to go back to the basics and find a way where they have the time to do that within their workday, or even things like learning how to navigate the payer sites and things like that.
Well, and there's always ways as well to come up with free resources.
Mhm.
Obviously, that's been our goal here with this podcast and putting this content out that we've been focusing on. But there's so many others in the industry. I saw Christine Hall at Sterling Global. She's going to be starting up more consistently again with her podcast in 2026, which has been great. Our friend Terry Fletcher, she has a great podcast, a weekly podcast. Sean, compliance guy. Sunal Patel has one as well. There's so many people we could name that have podcasts in our, circle of the industry and people that we know. And,
Mhm.
you can really benefit just from hearing the way that people talk about it.
Yes.
Sometimes when I started, for example, it really helped me to hear other people interacting with physicians and the practitioners to know, okay,
Mhm.
how do you bridge the gap between the two sides? How do you approach
Yeah.
them? How do you articulate this information? And even for myself, just last week I had another light bulb moment, and it was with Terry. Her and I were having a conversation, and she said something, and I was like, holy crap, I've never thought of it that way. And it makes so much sense, and it made it so much more simple.
Mhm.
So just casually taking information in can really help. And now, even with AAPC and the chapters, so many of them have virtual options. You can join these chapter meetings
Mhm.
all over the US through Zoom.
Yes.
So you can often get CEUs that way to help with that goal that you have for your certification. But then again, you're just hearing different professionals in the industry talk through what they're seeing, talk
Mhm.
through how they're handling it. And it's going to open your eyes and sometimes give more confidence and, help
Yes.
provide that framework to move forward and not just stay stagnant.
And I think it's also helpful from my perspective. Like you mentioned, Sean Weiss and the coding roundtable that you participate in with him. There is a wide range of personalities
Yeah.
sitting at that table, metaphorically. And I know, like for me, for example, I've always been more on the strict side, trying to make it black and white and things like that. And listening to you speak, and then the contrast to how Scott Kraft presents things and speaks. He's definitely more of that like laid back. I don't know how he does that, but he's just got this really laid back way with that he communicates in, and I think that can be really relatable and show you that you don't always have to be like we're, not that he's not professional, but he shows you that you can be professional while also just being yourself and not having to put on some kind of like, okay, today we are talking about, being
A
being
mask.
so, so rigid and regimented. And it's just interesting to see the different styles that you all have, and that alone, not just the excellent content and knowledge that we gain from your group of people there, but just seeing how you interact about the topics and how you've all handled things differently. You have different perspectives and things like that is super helpful.
Yeah. Yep. And hearing those approaches, I learned from them as well, the way
Hmm.
that they approach the
Absolutely.
situation and have conversations, all of that is very helpful. Now, before we move to thoughts on 2026, let's just talk a little bit on the positive side since we started with a negative. I always, I'm the Debbie Downer, I guess. I try not to be, but it's just,
We really aren't negative people. We spend most of our time laughing at ourselves.
yes. But, of course, we had to start with a big negative. But it's important for people to know. So it's
It
okay
is.
that it's out there. That's very important. People really need to be conscious of that as we move forward.
Hmm.
Now, for the positives of 2025, one thing, especially in the second half of this year, that I'm seeing is that there's so many more clients coming forward, at least in my situation, where they want help from the prevention standpoint. And, with what I do in the industry, there's so many times where I'm coming in after the fact, having to figure things out, look at the defense perspective. And it's very refreshing to start to get these phone calls and have these conversations with people about what they can do to prevent, issues in the future. And that's always a great thing to see when people are wanting to do their best. And
Hmm.
I don't doubt in general with any of my clients that that is the goal. If
Hmm.
it wasn't their goal, then I would question even engaging with those people.
Yeah.
But it's just been really great to see that people are coming forward and saying, hey, not talking and focusing on how compliance is a burden, focusing on,
Hmm.
okay, I've heard this is happening in the industry. Can you tell me more about what I need to be aware of? What can my organization do to be proactive? And
Hmm.
I really hope that as we move forward, more and more people are seeing that that landscape has changed. I can't tell you how many people I talked with this year that were surprised that they're under an audit or investigation as a one physician practice or
Hmm.
five or less providers in that practice. So word's getting out there. People are really starting to focus. They're noticing, compliance has never been an option. It's always something that is mandatory, but people
Yeah.
like to, play chicken with that and see how far they can get. So
They
it's,
absolutely do.
mhm,
It's wild to me.
yeah, it is. And yes, I love that work that I do on the defense side, but I also love helping people not get there.
Yeah.
And let me be clear, sometimes it's not avoidable. There's a lot of things that are happening that I'm seeing right now in the industry that, no, those people that are having to defend themselves, they're not in the wrong. But let's take a look at what's happening. Let's learn from what other people are going through, and let's move forward and being more proactive instead of sitting around and
Mhm.
waiting and saying, oh, I'm small, I'll stay under the radar, all of
Yeah.
those types of things.
Yeah. Don't take the chance.
Yeah. Do you have a positive you want to highlight for 2025?
I think it's kind of similar. I definitely deal with the other side of things compared to you because I'm not necessarily out there with on the client facing side. I do prefer to be on the back end doing the audits, getting the results out there, looking for those inconsistencies and trying to bring those forward through the audits. But one positive is I think this year I don't know what it is, but I just feel like I'm starting to see more of that impact and that change in the work that I'm doing. So when you have those repeat clients and you've been giving the feedback and then all of a sudden you get that audit for that provider again, you're like, "Oh, here we go again," and you see a change. And so it's kind of very similar to what you were just saying. I do think there's kind of been this awakening in the space of compliance where people are starting to see that this is a now issue. You don't wait until there's a problem because if you aren't looking, how do you know there isn't a problem? And it's important that you take a look at your policies and you take a look at what the providers and coders are doing and then make an action plan for those areas where you need improvement. And I feel like we've started to see some of that. And hopefully for 2026 we'll see more of that preventive coming through and more of that impact of the audit work because I know that I do try to put time and thought into the feedback that I'm getting giving, as I know you do too, and I want there to be an impact. I know sometimes people probably look at the audits and are like, what does this person know about anything? But know that there's nothing but good intent behind any comment and um, any feedback that's given. We just want you to do your best and be able to get paid for the work that you're doing and be as successful as possible in the compliance world.
Yeah. And, looking forward to 2026, that's really something that I've been thinking about as far as continuing to push forward and thinking about change. And not only that, but thinking about all the struggles we're seeing. I've had a
Hmm.
lot of situations this year where the outcome of an audit reflects issues within documentation and
Hmm.
having to have those continual conversations about what needs to be improved, what needs to be changed. I say it all the time, but it's just so burdensome to our physicians and practitioners. And I really think as a whole, we need to start scrutinizing and looking more at the tools that are being used. We always
Hmm.
talk about it's almost every single training and education session I do. I talk about things like using copy and paste, bringing documentation forward, macros, templates. We say the same thing, but instead of just talking generally, I really think in 2026 we need to be drilling this down more
Hmm.
specifically. And Michelle, you had told me a couple of weeks ago, I think it was, about a scenario that you were seeing with the way the system was pulling in test results. And I
Yes.
just had never thought of that. I had
Me
not seen
neither.
it before. It just was a
Me
whole other
neither.
light bulb moment about how
Mhm.
we have all of these moving parts and we need even just documentation. We need that for different purposes in the industry. It's more than just us wanting it to support coding and billing,
Mhm.
but we've really got to get a grip on paying attention to how these systems work and being able to monitor these types of things more closely and more specifically. Can you speak to some about that situation you
Yeah.
have with those lab services?
Yeah. So, first of all, what I'm finding is these EMRs are preaching, we're going to solve your documentation problems. We're going to just make it flow so easily for you. And with the new guidelines, it's almost like we don't need all these templates anymore. It would be best if you just had a blank sheet of paper, I'm going to say, because I don't know what else blank
But don't
document
really do it. Don't
in
use the
front.
sheet of
No,
paper.
please do not. Please do not use the sheet of paper. Um, the blank document, in front of you, and just document why your patient said they were coming in, the pertinence, to the history, to the physical exam you performed, and then document your work of the encounter. And I tell you, it'd probably be a lot more simple than using all these templates and then trying to go through and make sure that everything uh is accurate. So this particular example, it was from a couple weeks ago. We had just had this conversation about data analyzed, and how you cannot take what the EMR pulls in at face value. The provider has to show you how they used that information to make their treatment decisions. Why was this pertinent to today's visit? And I'm auditing this chart, and they build a certain level of service, and I could tell it was based on this data that was blown into the chart, and it honestly did not support that level of service. But then as I'm looking, because whenever I am crediting review, I'm always going and validating, where did this come from? Is it possible that they reviewed this at a different encounter? And I saw later that day the patient went to the ER. Well, these labs that pulled into this note were from that ER visit that took place after the encounter with the provider. And why they got pulled into this chart is because the provider did their documentation a day later. So when they went in to do the documentation, the system pulled these labs in, labs that weren't even available to the provider during the encounter. And they were trying to build that as data analyzed. So if they weren't existent when you were forming your treatment plan for this patient, how is that pertinent to the encounter? And that's just one way how you can't take it at face value. You have to be looking at, how does your EMR work? How do these things within the EMR that are supposed to be automating the documentation, how are they working? What is the workflow? And are the providers actually reviewing this documentation? Because this was a huge old section of labs. It's not like it was like this big amongst this extensive note. It was this big old section of labs that had happened in the ER. So it's not like, you know, the provider could have been like, oh, wait, these were after. Got to remove that. That tells me the provider didn't even review the documentation, didn't even review the templated portions of that note. So that is a huge concern right there. They're not doing the proper workflow to be using those tools in the first place. So I think that that is something in the next year, that people who use EMRs and rely on these tools like copy and paste, um, even things like the AI scribe. I know I sent you a funny one the other day about the skin tags.
Yeah. Yeah.
That was quite the typo.
Well, they were trying to refer to 4 separate skin tags,
And as
and
you can imagine,
it wrote, we could just say it, it wrote the word foreskin in there. So it was saying there was 4 skin tags on this person's neck.
yes, I was like, oh, this is embarrassing. This is what would show up in my note. You can tell I'm turning bright red because I'm embarrassed for the provider and the patient. That's what would show up in my note. And then I'd be like, son of a gun. Now,
Well, and to your point about just the structure of the note, I want to focus on
mhm,
that for a second, because what we find is, we had changes in 2021. Our guidelines were overhauled in the outpatient setting in the office, then 2023 everywhere else. So we've
Mhm.
had this in place at a minimum for 2 years. And it is very rare that I will open a note and see that any of the different EMR systems across the board have changed their structure to the newer set of guidelines. So
Mhm.
we're always seeing the 10 review systems, the 8
Yeah.
organ system exam. All of these things are still in here when we're saying, no, we actually need to focus on this other area.
Mhm.
So when we talk about these things today and thinking about 2026, a big thing that has helped me in this particular area when I'm trying to figure it out is getting in contact with someone, whether it be the physician or practitioner or a practice manager, a nurse, somebody, and looking at how the system looks on the user side. We
Mhm.
usually, from compliance, when we do auditing and coding, we don't typically get to see what the user side looks like. But there's a lot that can be answered about the questions we have, which
Mhm.
can then move forward in talking about how are we going to correct this? What could you do? If we need more information in the assessment and plan, what else are you doing in all of these other sections of the note that's producing a 30-page one visit progress note?
For an ear
How is this
infection.
happening? Yes, for something very low complexity.
Mhm.
So figuring those things out are going to help a lot because sometimes it's just a matter of talking about it with the providers. I've had situations as well where I go through this exercise and I can talk with the vendor of the EMR or like the practice administrator. They can go to the vendor and they're able to fix it on the back end, and you don't even have to tell the provider about it. So there's all of these different things that can come into play with this, but people are not taking that step, that next
Mhm.
step after identifying there's a problem or, giving that caution sign, be careful when you use these tools. Well, why do we have to be careful? What do we do to fix this? What do
Mhm.
we do to monitor this? And remember, this is something where these developers, these companies, the software that's being used, they create this, but it's not their job to monitor it. It's not their job to control how someone uses it and to control what the
Mhm.
outcome is based on that usage. So it's not just, oh, I purchased this, we're set, let's go, we never change our process going forward. That
Mhm.
continually needs to be looked at and scrutinized and then coming up with solutions. So if you are coding and you're always seeing the same type of issue coming up, say something about it. If you are not ready or if your department doesn't want you to go directly to the practitioner, then take a step back and say, okay, who else could we talk to find out why it's happening?
Mhm.
Maybe the help desk can walk you through it. There's always training people within the IT department that are onboarding people and all of that who have a much more intricate level of knowledge in that system because they're training how to use it. So think outside that box and what you can do. And it leads into another area that I feel is very important we highlight, and that is everything that's continuing to happen around AI.
Mhm.
And I've started to research some and read some articles last week about what AI looks like right now in the country, the way that it is being categorized. There's a lot of unknown out there, but there's different areas where it's being implemented in multiple industries, just not just healthcare, but multiple industries, and they're looking at the level of risk of the tools based on the industry. So something like employment could be high risk because that could be a biased system that's completely,
Mhm.
taking away opportunity from certain types of people. There's, in healthcare, that's also considered to be very high risk. We're talking about medical documentation. We're talking
Mhm.
about legal documents. There's a lot of thing that goes into that. Not
Yeah.
only that, but the practice of medicine and
Mhm.
in how this integrates in.
Yeah.
So moving forward, so we just talked about the system, the software, monitoring, being more active. When we think about AI, this year in 2025, I've come across many clients that did not fully know what that technology is doing in their system.
Mhm.
Meaning they have a contract with an EMR vendor. It could have been something that was an add-on option. Their organization decided to pay for it and now it's there and their providers are using it. But we don't fully understand, and a lot of people are still very afraid of what this is going to look like. So we need to start diving in, researching again more specifically how this is happening.
Mhm.
And from the oversight perspective, I want to just read a couple of things. I made some notes about trends that I'm seeing in the different regulations that are coming out. So we have some that are currently in effect depending on the state. Next year, there are more states that are going to be implementing laws around this. But overall, the trends that I'm seeing are related to things like transparency and disclosure. So if
Mhm.
we think about, just like HIPAA and the way those disclosures have to be made, where do we even start to know what AI is supposed to look like? What are our guardrails? When would that be breached? So transparency, understanding what's in the system, understanding how it's being used, making sure that there's a trail of that, an audit trail. If
Mhm.
we get to a specific conclusion, how did it happen? Somebody needs to be able to track that back. So having that human oversight component is going to be huge. Making sure we don't have discrimination, making sure we have that data privacy. I have some clients, for example, starting to use AI in the mental health specialty. And that can have very sensitive information that's being discussed. Are
Mhm.
you letting your patients know that this is being used? Are they being given the option to turn that down? How is the vendor that you're using storing that information? There's a lot of things that need to be looked at that we just can't take at face value from the organizations that are putting this out that you're purchasing from.
Mhm. And you also have to consider not just from within your own EMR or resources that you have available, but payers are using AI. So
Oh, yeah.
you need that oversight before it goes out the door and then after it goes out the door. What's happening to it? We know auto downcoding has been quite the hot topic and things such as that. So you have to all sides of the spectrum be
Mhm.
watching what AI is doing and keeping on top of that because it can cause issues before it goes out the door and then there could be issues that might be a little bit harder to identify, but you're going to have to pay attention to how your claims are being paid, what's being denied. Are you seeing a big difference from your level 4s down to level 3s kind of things, with that auto downcoding and things.
Sorry, the neighbor's dogs are going crazy, so let's hope the one who's in the room with me will be quiet. We don't know if she will be. But I
Oh.
wanted to say I met with someone actually this morning. I've had different people in the tech side of the industry just reaching out, wanting to get some insights on, how these tools are used, what are people's concerns in the industry, things like that. And they were talking about the fact that we're now entering into this space where we have what he was referring to as an AI agent, so that entity that's doing work in there, and how we have other AI agents that are overseeing their work that's being done, and how we're now getting these layers of AI between, like you were saying, Michelle, the provider side, then it's going to the payer side. They're both using different agents. Then we have different entities that are starting to develop programs that can oversee that. So another AI agent who's overseeing AI, and it's like, okay, where is this human component? And I look at that when I read that word transparency. That's the type of thing that, I think is really going to start to come to light this next year, because from a compliance standpoint, we need to know everything that's happening. But not only that, how are you monitoring? What steps are you taking? Do you understand how the system works? What are you doing when you find a
Mhm.
problem? I did an audit recently, and with the AI ambient scribing, a note was showing that a patient had over 750 BMI. And it's like, okay, well, that's not humanly possible to my understanding. So we have an issue with the scribing that took place, and we already know we're going to have issues with our physicians and practitioners not really doing the best job reviewing those notes,
Mm-hmm.
which then is going to be a concern when we think about legal issues, malpractice, all of those types of things that could trickle down and come about if this stuff is not being monitored.
Yeah, and also remember, patients have access to their charts and documentation. And I know I certainly take a look at what's being documented. So you need to keep that in mind. And it's only fair to your patient to make sure that that is as accurate as possible, because not only, I think sometimes when we're dealing with compliance, we focus so much on what we need for billing and what we need to support compliance. This is also continuity of care for your patient. So look at it not just from a compliance perspective, but what kind of care you want to give to your patient. And if I had a provider that was like, I'm going to use this AI ambient listening for documentation, and then I read my note and there was all of these, errors and a BMI of 750, that's already a touchy topic. Yeah, you know what I mean? Like it's gonna, for me, it would really bring into question what's the quality of care that I'm
Mhm,
receiving. And um what level of detail is this provider going to pay attention to my health with, if this is usually, I mean, BMI is in big bold, sometimes red letters in the note, you know what I mean? So
mhm,
think of it from the perspective of the patient. And if you are a patient, we all are patients. I don't know one person who has successfully avoided the doctor. And be looking at your documentation and start holding things like that accountable. Because it's not just a compliance issue, it's also a continuity of care and a quality of care. And that's part of it, is making sure that there's reliable documentation for your patient to use down the road should they need to move or go to a specialist, or a whole host of things that that documentation could be used for that aren't even compliance related.
mhm. Well, and there's been a real lack of accountability in
Hmm.
this area, just
There has been.
from the perspective of technology. It doesn't even
Hmm.
have to be the AI component, just the use of technology, the use of the EMR. Organizations are not holding people accountable to what the outcome is and what that means for them later on. And it's often something where you can pause, you can
Hmm.
correct, and then move forward. It
Yeah.
doesn't always have to be this big disruptor, but
No.
you've got to understand what it is before you go trying to accomplish, improvement. You need to be ready yourself to have those conversations or reach out and get someone external who can come in and help you with that and make that a better experience, because the clients I've worked with and have tried to help in this particular area, yes, there's definitely pain points in conversations or people who don't want to put in the work to get to that point. But
Hmm.
at the end of the day, when we do, it works out so much better. And then we have a lower level of risk when we're looking at, mitigating that outside risk with those external audits. Why not have improvement, especially with the way that we see that these continue on every varying level from something small to something large that turns into an investigation.
Yeah, exactly.
All right, so we will go ahead and end there. Like I said, this is going to be our last episode for 2025. We're going to take a break for the holidays. And I know I'm looking forward to it. I always try to structure my work in a way where I get a nice downtime towards the end of the year. A lot of people are off and out of the office, and it's a good way to refresh and
Hmm.
get ready to jump back into the new year and, hit the ground running.
Yeah.
All right. So we'll see everybody back in 2026.